Hi guys, welcome back to the Health is Wealth Connection. Today we are so thrilled to announce that Health is Wealth Family Care is now a Biote Certified Provider. What that means is Brandy and Melissa are now certified to offer hormone pellet therapy to patients. This is something they've worked really hard to accomplish, and we are so thrilled we can now offer this to our patients.
Hi guys, I'm here with Melissa today, and we are now certified Biote pellet providers. And so this is something we're bringing as a service to our patients. It's not for everyone, but a lot of our patients were wanting to get them done. They have had, either bad experiences, good experiences, but our goal is that we would understand them, we would do them conservatively, and definitely make sure we're monitoring really closely. So we're excited to be able to offer this to you. And so just to give you a little background about why we're doing this. And the reason is that we just want to make sure that we're giving you great pricing, that we're staying certified, we're doing things by guidelines, and it's just another piece to offer for people who may not tolerate, troches or creams or, oral medication. And so if you're interested, please reach out. I'm going to read to you a little bit about what it is because I can't say it any better than with the company, how they say it. So hormone pellet therapy, it's a form of hormone replacement therapy. They're small rice-sized pellets contain bioidentical hormones. And bioidentical means like your body makes. They're actually made from plants. They're very safe. Usually in the hip or the buttock area, that's where we prefer to do it because there's, not a lot there that can go wrong. They release a consistent, steady dose of hormones over time, typically lasting 4 to 6 months. And that's another one of our goals is if you're feeling great, we can expand that time. It doesn't have to be every 3 months. So if we get you to 6 months, you're feeling great, your levels look good, all right, we're great for that. So as we age, even by the time you get to 40, 50% of our testosterone declines. If we're talking about men, we're talking about women. Who would be a good candidate for this would be people with loss of bone density. Let's see.
Yeah, energy, mood changes, libido.
Depression, anxiety, libido is the one that people go to all the time. There are actually some Traverse studies that have shown that it can actually help decrease the risk of cardiovascular disease. There's some even saying potentially cancers. I think it's still probably early to say that, but I think it's worth thinking about. Patients with active cancers, this is definitely not for you. Yeah. People with elevated PSAs, this is not for you. People who have a blood clotting disorder, this is definitely not for you. But I would say, you talk to your provider with any hormone therapy about risk versus benefits because there are complications that come up. That's Absolutely. What we don't like to see, right? People with postmenopausal bleeding, that has to be evaluated. That's very serious, but sometimes that happens because we forget to take our progesterone if we're on estrogens. But people loss of bone density, cardiovascular risk, I think it's something you could definitely consider. Symptoms of hormone imbalance in men, do you want to share that?
Hormone imbalance in men, yes. Kind of the same as females,
right?
Energy, low libido. A lot of them will say they just don't have mental clarity. So as far as brain fog is a big one. Motivation is a big one.
Stamina, things that we have to think about if you are somebody of reproductive ages, and it doesn't matter if you're 20 or if you're 50 and you're somebody who's considering having more children, that's not right for you either because it can cause infertility and lead to decreased sperm count. So that's something to consider. And our goals, we want you to feel well, we want you to have good bone density, we want women who are going through this perimenopause, menopausal state to do it with dignity, feel good, and not have to suffer with all those symptoms all along the way.
Absolutely.
How long does it take to work? Well, I will share that I had my first pellet done yesterday by my awesome certified provider friend. Yeah. We went extremely conservative because I feel great, but lots of times I want to try what we're prescribing so I can tell you, it was good. Yeah. I had a very brief instance of headache last night, which I don't ever get headaches, so that was probably a little bit of hormones. I didn't have to take any ibuprofen, Tylenol, it went away, so hydrate it well. And it could have been allergies, who knows. So within those first 4 weeks, people should be feeling different, but this is not like a quick, easy fix. Be always afraid of the quick, easy fix. Everything takes work, everything takes time. And with us going conservatively, you want to give us a year when you commit to this because we want to optimize it. We don't want to overdo it, give you too much hormones. So hopefully you're feeling great in 4 weeks. If you aren't, we can make adjustments sooner. And then we will adjust your next pellets, right?
Absolutely. Yeah, we'll do labs before to make sure you even need the next pellet. So
absolutely.
A lot of guardrails in place and we're excited.
Yep, we're sticking with the guidelines and we're going to do things correctly. And the process of becoming a certified provider, so we had to take courses prior online. We have had our awesome rep, Jen, in here with us. I mean, amazing. Yes. Every single month for the last 6 months. It's not something we take lighthearted. We went to Texas and we had a good time there. Fun. and we've learned a ton.
We did.
So you'll see even more things coming back with thyroid optimization and things like that. And just even as simple as making sure we have enough iron in iron stores, right? For T3 conversions.
And if pellets aren't for you, there are other options. We can do topical things. We can do patches. So this is an overall look and what's best for you. So we're talking about pellets here because we can do those now, but we have other options as well.
Yes. Yeah. And if you don't need them, we're not going to tell you need them.
Right.
If you are wanting to check out pellets, and pellets, just to clarify, are testosterone and estradiol. If you have a uterus and you're on estradiol, you want to be on progesterone, you need to be committed to taking your progesterone. If you can't do it, you don't think you remember, it's not right for you. And we get it. We're all bad patients at times about some things. So, but the process of getting it, you do not have to be a patient. Our members do get better deals. This right now we're offering for the first 90 days, no consult fee for our members, so that's a really good benefit. And then after that, we'll still keep those consult fees very low. The more we do, the better pricing we get. That's why we're trying to get those first 90 days. But again, this is not pushy, guys. You know how we are. We're only going to do what's best for you, and we're not going to recommend it if it's not good for you. And then we're here if anything comes up. If you have questions, concerns, please reach out.
Sounds good.